And the next thing is, if you lie down at night, do you have gastroparesis? A lot of times with this gastritis kind of feeling, the food can sit in there too long. And the longer that food sits in, it can irritate the mucus layer on that gut lining, on that gastric lining, and it can weaken it. Obviously, when you go flat at night too, if there's gastroparesis, which essentially gastroparesis is essentially like paralysis, slowing motility that starts typically in the stomach, and that food sits longer. So when you eat and then you go horizontal, let's say you eat at 7, you go horizontal, i.e. go to sleep at 10, that food may still be in your stomach and that could come back up on you and actually burn your esophagus. So an easy tell on that one is just get a 15-degree, 20-degree wedge pillow, or you can just prop your pillow up and give yourself a little bit of incline. That will keep your acid and your enzymes, or your acid down a little bit and off that mucosal tissue here, right? The esophageal tissue, it's normally going to be squamous, and that tissue will actually thicken up and turn into columnar tissue when there's lots of acid. That's known as Barrett's esophagus. So that's one thing you want to look out for when you have that upper left-hand quadrant pain, is that esophageal burning that can sometimes extend into that left-hand quadrant. Really important. Outside of just like your typical gastritis and stomach issues and esophageal issues, obviously you could have costochondritis, which is going to be rib issues, rib pain. The big tell on that is going to be, it feels like someone's sticking a knife in your chest when you're breathing. Someone sticking a knife in your chest or in your back when you're breathing. And there could be a rib subluxation issue going on with that. That could be one. It could just be the cartilage is inflamed from some kind of exercise or movement you're doing. Obviously, we have our straight up heart pain, our angina, right? We can go to the ER and we can get like a troponin test done or an EKG. Troponin's going to look at heart tissue. You can also run an AST as well. AST, different isoenzymes of AST and troponins are helpful to really isolate whether or not we have heart muscle being broken down. That's helpful as well. Those would be the big ones in that area. I mean, you get your spleen a little bit on the side. That's typically not going to inflame unless you got really hit or fell, and there could be a rupture. But the big issue are going to be on the stomach, right? And so the big things you have to look at, what are the irritating foods? The irritating food. So coffee can sometimes be irritating because it's a kind of a paleo. People like coffee, right? So that could sometimes be irritating. Sometimes a lot of the nightshades in the tomato sauce can be very irritating. That can be a big one too. Gluten, of course, is going to be a big one. Dairy or the casein in dairy will be a big one as well. So those are good things to look out for as well. Other foods, of course, like any of your processed grains, processed flour, processed fats, those are all good things you want to look at because anything that's going to be inflammatory can weaken that gut lining. Now, what do you want to do? So out of the gates, you want to look at the irritating, agitating foods that could be throwing you off, and you want to pull those foods out. That's going to be big out of the gate. Next, I would say is you want to look at healing, soothing nutrients. So my top ones are going to be bone broth, going to be excellent, or collagen peptides, which are, again, really high in glycine.